Hey everybody, I'm Maggie, and we're here on another SRH Access Facebook Live. Today we are very fortunate because we're here with Amy Lake, who is a hand therapist on our hand team. So we're really excited to have you and get another look at our hand service here at the hospital.
Thank you for having me.
Last week, Dr. Rite joined us, and he really gave us an inside look at the common conditions that we treat for our hand conditions. And today, we're really looking at this whole child approach and how we provide therapy to our hand kids.
Yeah.
So to kind of get this started, what can you tell us about what you do for our patients here?
Well, I am an occupational therapist and a certified hand therapist, and I work with Dr. Oishi and Dr. Stutz on the hand team. And we see, just like Dr. Oishi said last time on Facebook Live, we see a gamut of different diagnoses. We see kids with a lot of congenital anomalies like polydactyly, syndactyly, symbrachydactyly, radial and ulnar dysplasia, amniotic band syndrome, macrodactyly. We see kids with arthrogryposis, brachial plexus injuries, and cerebral palsy. And then we also see kids with traumas and injuries like fractures and tendon injuries and things like that.
A lot of stuff you see.
Yes.
Really helping these kids.
Yes.
Another good question I think a lot of parents want to know is, what can a patient or a mom really expect when they come into clinic with you guys, and who are they going to see, and then what is your role with that as well?
Yeah, so a patient comes to Scottish Rite Hospital, they register at the front desk, and then they are put into a room. They're seen by our clerk, they're seen by a nurse. The doctor comes in and sees them. If we have fellows, they get to go in and see the patient as well. And then the therapist actually tries to go in with the doctor at the same time. And if there's a need for therapy, then we can treat them right here at Scottish Rite Hospital. We have a treatment room that we can bring them right over to from clinic. And if it's something that we can do right here that same day, then we will do that. If it's something that they need ongoing therapy for and they live far away, we can refer them out to a therapist locally, close to their home. If they live local and they need ongoing therapy, we can see them actually right here at Scottish Rite Hospital.
Awesome. We're actually in the coach's corner. I think that's the right term.
Yes.
So what happens in this room? What goes on in here?
So yes, this is coach's corner, and it's kind of, we look at ourselves as therapists as kind of like a coach, and our patients as the athlete. Yeah. And we're trying to teach them to get back to whatever it is they need to do. So independence is kind of our goal, whether that's a simple task like bathing or dressing, hygiene, eating, things like that. We'll try and provide equipment or exercises or splinting in order to help them become independent. Maybe it's to get them back into school and do school-related activities or a sport. Whatever it is that they are lacking independence in, that's what we're trying to provide for them.
Awesome. I think the majority of our session today, we're really going to get into the show and tell portion and get to all these really fun adaptive devices and toys that these kids get to use. But I think another question is, what is it that these kids are doing when they get here? I mean, you're going in there and you're evaluating them, but what can they expect ongoing, and how can they, like, depending on if they're getting surgery or if they're not getting surgery, are you handling them before? Is therapy before that, or is it after that?
Yeah, so we see a gamut of kids for different reasons. Sometimes we see kids before surgery to prepare them for that surgery. We're looking at the way that they use their hand. A lot of times Dr. Oishi will send a kid over here for me to just play with, so that we can understand how they use their hand and where they pinch and where they grip, and how they do that in a more relaxed environment versus in the clinic room with a doctor and a white coat on. We see kids after surgery for strengthening and exercise and splinting to help maintain their position. And then we just see kids a lot of times just for activities of daily living, just helping them increase their independence with a use of alternative techniques or videos to show them how to do things, or maybe some adaptive equipment.
Awesome. And I think it's great because, I mean, you guys are really here at any point in care that's really needed for the patient. So let's get into the fun stuff.
Okay.
There's a lot of things on this table, so let's kind of get through and just kind of show everybody what you do with these kids.
Yeah,
So
okay.
wherever you want to start.
Okay, well, let's just kind of start over on this
Okay.
side of the table. So we have a lot of adapted utensils for things like that are school related. So we have some adapted scissors for kids who are unable to possibly grip and grasp and release different scissors. These scissors you have to grasp to close, but then they're really easy to let go of. These scissors here you're able to utilize them very differently depending on where your strength is. You can even do it two-handed. So these are really two of the scissors that I use a lot for kids that have weak grasp or different kind of anatomy in their hand that are unable to utilize regular school scissors. So there's those.
Okay.
Over here we have some pencil grips. So we do a lot of handwriting evaluations. Kids come in to see us and they're having trouble writing, maybe because of their anatomy, maybe because of their grip strength. So we have lots of different pencil grips that we can utilize to help them hold the pencil a little bit better. Maybe it helps them so they don't have to grip so tightly. They're able to have a little bit more endurance with their handwriting and tolerate that a little bit longer. So we have lots of different options for that.
You know, that makes me think about with parents, and I'm sure they're probably very involved in some of these therapy sessions and watching how you are with the kids.
Yeah.
So is there some education that you guys are providing parents with when they're doing these therapies so that when they're at home they can also help the kids out as well?
Absolutely, absolutely. We have the parents front and center right there with the child, and it's not really that you're just treating the child, you're treating everybody, and everybody has to be on board with the home exercise program. And so we teach the child and the parent the home exercise program. We have them practice in front of us to make sure they understand how to do it correctly, and then they're given a handout that's, you know, a printed written handout that they take home and are responsible to hopefully do their exercises on a daily basis.
Yeah, that's hopefully is the big one. What is this little contraption?
Okay, so this is a button hook. So buttoning is sometimes really difficult for our kids that have weak grip strength, who don't have a lot of grip in their hand. Our kids with arthrogryposis, a lot of our congenital hand kids. Sometimes they don't have very much reach. Our radial dysplasia kids have minimal reach depending on the way that their hand is formed, and so we can bend this and wrap it around their hand. And what you do basically, and we've got another one here too that just has a bigger grip, and it's just kind of an interesting little way to do your buttons. Basically you just go through the hole. I can do this, I don't know if you can even see this, and then you grab the button and you pull it through, and it's a way that you can teach them how to do it independently with one hand with some practice. So it's just another way to do buttons. We also have zipper pulls. A lot of times kids are having trouble with getting their zippers done, so we can introduce some zipper pulls to them. Tying shoes is another really big thing for a lot of these kids. Some kids just have one hand, so we do have a video that teaches them how to tie their shoes with one hand, but then some kids are unable to do that because of strength. And so we do have shoe buttons that allow them to tie their shoes independently, as well as some elastic shoelaces.
I mean,
too.
some of the things that you just would not, I think you maybe take for granted on a daily basis that would really help just for daily living.
Some of the most rewarding moments in here have been teaching a kid how to tie their shoes by themselves independently, and mom's crying, the kids crying.
You're probably crying.
I'm crying, yes. It's just a really emotional, fulfilling moment.
Wow, that's great. Okay, so we have shoe tying and we have buttons.
So we can move this off.
Okay, so what about some utensils? That looks like that's a big...
So we have lots of really cool spoons and forks and knives and things like that. And some nice ones, especially for like our radial dysplasia kids, are these curved utensils. They have a little hand that's curved in, and so getting that hand to the mouth is sometimes a challenge. So using some curved spoons and forks makes that a little bit easier. We can even use, this is a little wristlet that actually holds a utensil right in here. So if they don't have hands or they don't have any grip strength at all, like for instance this little guy here, it just holds those utensils for him so that he can write or eat or do some of those things.
Okay.
So he doesn't have to use any grip strength for that.
Is there a certain age that you're introducing these devices?
Yeah.
So obviously, they have to be at a point where they are feeding themselves and all that. But is there a certain age that you're seeing?
We try to do it developmentally when they are able, when they are starting to eat and want to start, feeding with their hands and things like that. So we try to hit them right there at that development period of time if they're ready, and try to get these utensils introduced. So that's an age-appropriate time.
Right. Okay, so they know nothing different, probably.
Yes.
Okay, let's get into this. Cool.
Yeah. So we have a lot of just exercises. So a lot of our kids are older, and some of these fun toys that you see on here would not work for a 12-year-old or 13-year-old. And then a lot of our kids with just plain injuries, fractures, and things like that we need to get them back to football or soccer or dance or whatever it is. So we do a lot of ongoing therapy that would include strengthening and range of motion. We're testing their grip strength. We're measuring their range of motion. And then we give them different exercises that would increase their strength, increase their endurance, increase their motion through exercises we do here. And then we can give them stuff to take home as well, like therapy. We teach them how to use weights at home and just get them back to sport or school or whatever it is that they need to get back to doing.
And I know that you're involved in some of the research that the hand team does.
Yes.
And so with like measuring their range of motion and their strength, is this kind of a device that they measure that with? Is that part of some of the research?
Yes, depending on the study, some of our kids are unable to grip this device. It's just big and large and hard for kids. Yes, with arthrogryposis and things like that. But we definitely use our goniometers on these kids to measure their motion and things like that.
Cool.
Yeah.
We have some toys.
Yeah. So
I can move this out of the way.
So we do have lots of toys. Obviously, with our younger kids, our toddlers, and our school-age kids, toys are very important. I'll move these little guys right here.
Yeah, we'll have to get to those last.
Yes, these are my favorite.
Cool.
So especially with our arthrogryposis kids, we're trying to teach them a lot of elbow range of motion, and sometimes you want to take gravity out of that picture and do some gravity eliminated exercises. And we found that the use of cars is a really good way on a tabletop to do that with very little resistance. We can even teach them how to duct tape spoons and forks so that they're able to teach themselves how to eat. And then mealtime becomes a very therapeutic time at home. So we do that a lot with our arthrogryposis kids that have tendon transfers.
Okay, very cool.
Yeah, and then obviously you need some fun little toys for babies. I mean, we see babies from days old, all the way up to 18. So we have to be kind of ready for anything and everything. And with our babies, we utilize a lot of rattles and noises and visual toys just to kind of keep them entertained and calm and just to get them engaged a little bit, or to calm down if they're crying.
I mean, you were talking about the babies that you see. So is there kind of a common timeline of how often you're seeing the kids that are in therapy? Is it once a week? Or it kind of depends?
Yeah, it really just depends on kids. I mean, we see kids in clinic. It could be every month. It could be every 3 months, every 6 months, every year, every 3 years. So, the kids that are coming through clinic that we're seeing, it just varies dependent on their diagnosis and how well they're doing and how they're progressing. And then for therapy, it just kind of depends. I mean, when we do outpatient therapy here at the hospital, it's goal-directed intensive therapy for something specific. So either they've had a surgery and we need to rehab them, they have something that they can't do, an ADL type of activity, and we're going to teach them how to do that, and that might be a couple visits. So it's really goal-related and directed, and as soon as they attain that goal, then they're discharged from therapy.
Okay, cool. All right, let's get to these.
So these little guys, these are my favorite, and we have the Star Wars movie coming out really soon.
Yes, this is perfect.
So I saved them, but Mr. Potato Head is really my favorite toy for kids that need fine motor coordination, strength, opposition, things like that. So a lot of our polydactyly kids, our thumb polydactyly kids that have surgeries, or our kids that need polycizations, which is moving the index over into the thumb position, and then you need to teach that thumb how to work. Opponents plasties, so a lot of our kids that really need that thumb opposition exercise and strength. So we use these guys pre-surgery to kind of determine how they are using their fingers, especially if they are born without thumbs, Do they pinch between their index and long? Do they pinch between their
What's
small?
natural, essentially, for them?
It's different depending on the kid and their anatomy. So if they're an index long pincher, then that's a great candidate for a pollicization.
Okay.
And so usually the doctors send them over here and let me just play with the kids for a little while and kind of try and figure out how they use their hand so that they can kind of determine what surgery they're going to do. It's fun. It's fun to be in that process and help the surgeons a little bit. And then obviously we use these guys after surgery to really get their fine motor coordination. It's a bimanual task, so it takes 2 hands to do a Mr. Potato Head, and it's a pretty inexpensive, cheap toy that parents can go out and buy on their own.
Awesome. To kind of wrap, I mean, this has been fabulous. This show and tell has been so great, and I'm sure parents will, if you have any questions, post below, and we'll make sure that Amy gets to those later on. But to kind of wrap things up, I mean, I know that we can kind of touch on, I know we do camps and kind of outreach programs to really help these kids kind of feel comfortable in their element, and maybe you can kind of just shine light a little bit on that.
Well, I think our main goal as any clinician is really to help our kids become as independent as possible and go out in the community and be contributing members and be happy and participate in life, really, whatever that looks like. And we found that sometimes with these kids that have are born with a hand difference, they do have a psychological aspect that's kind of associated with that, and they tend to have a hard time accepting their hand difference. And so we found through our support groups, both national and local, as well as camps, we're able to really teach these kids some self-confidence, some self-esteem, help them increase their independence, and really feel accepted and really not be defined by who they are on the outside, but really be defined by who they are on the inside.
Wow, that's awesome. Thank you so much for coming today and teaching us a little about your world and what you do with our patients. I mean, it's a very big part, and it's really cool to be able to see the inside look. So thank you guys for joining us. We'll be back next week for our last episode of SRH Access for 2017, and then we'll be back in 2018. So thank you.
Thank you.